we're suffering from TMJ or jaw pain, we can do a few different exercises to help ourselves out a little bit with that. So the first phase is what we call range of motion phase. So for Charity, we're going to pretend as if she has left-sided jaw pain. And so we have a piece of tubing. You can use a piece of a straw or anything like that. The tubing is a little bit nice because we can compress it, so that's going to be helpful for us in the later phases. But we have it between our teeth. We're not really biting down on it hard, just enough to apply just a little bit of pressure. And so for this first part, Charity's going to slide her jaw away from the affected side. So our left side hurts, so she's going to be sliding it to the right. She's going to do it before it reaches any pain and before she has any clicking or cracking or noises in the jaw. So you're not trying to push past that, you're just trying to get up to that point. And we'll do that for 6 reps. That would be 1 set, and we'll do 6 sets of this exercise. This phase is called the bite phase for the TMJ protocol. So Charity has her pain on the left side of her jaw. So it's similar to the range of motion phase where we slide our bottom jaw over, but now we're going to submaximally compress that tube for 6 seconds, 5 seconds. Good, we'll relax there, and then we'll return back to our normal position. So that would be 1 rep, and then we'll have Charity slide over, squeeze, 2, 3, 4, 5, good, relax, and slide back to normal. So that would be the bite phase. We want to do 6 reps and 6 sets of this exercise, so a total of 36 total reps. The next phase of the TMJ protocol is the bite return phase. So this phase builds on the bite phase. So Charity's left side is affected, and she's going to be sliding her bottom jaw away from that affected side. It's going to be in the pain-free range of motion, and it's not going to have any clicks or clunks. So if it's clicking or clunking, you're probably taking it just a little bit too far. So we want to be in that comfortable range. So she's going to slide that bottom jaw over. She's going to submaximally squeeze, except this time she's going to hold that squeeze and slowly return her jaw back to the middle. And then we'll repeat there. And slide back to the middle. Good. So we'll do 6 reps of this exercise. Give yourself a break, and then come back and do 6 more sets. So a total of 36 reps. The next phase in the TMJ protocol is protrusion. So that would be taking our bottom jaw and jutting it forward. So if we have the tubing in our mouth, as you jut your jaw forward, you should see that tubing go up in the air. And then you'll come back to neutral and up. So we're gliding that bottom jaw forward and then gliding that bottom jaw back. And so same thing here, it shouldn't be painful and you shouldn't be getting any clicking or clunking. And we'll do that for 6 reps, give yourself a break, and then do that for 6 sets. So a total of 36 reps on the jaw protrusion. All right, here is a side view of what's going on. So Charity has her head nice and neutral, so she's not going to move her head at all. She's going to protrude that bottom jaw and bring it back, and protrude, and bring it back. Good. The next phase of the protrusion TMJ jaw exercise is adding in a bite. So as Charity slides her jaw, bottom jaw forward, she's going to bite for 5 seconds, hold 2, 3, 4, 5. She's going to relax, and then she'll glide that bottom jaw back to neutral. So we have glide, bite, relax, and glide back. This part, she's going to protrude her jaw, glide it forward. She's going to bite for 5 seconds, and then she'll relax and slide back. So we have slide, bite, relax, slide. All right, the next phase is the bite and return phase of the protrusion. So we have Charity protrude her bottom jaw forward. So you should see that tip up. She's gonna squeeze and then slide her jaw back. So we're not holding on this one. we're just going back to neutral. So she'll slide that jaw forward, squeeze, keep it squeezed, slide back. Good. So that is the bite range of motion portion of the protrusion jaw exercise. Bottom jaw forward, bite, slide it back. The next phase of the TMJ jaw protocol is a isometric contraction. So we're actually going to use our hand to help us out here. So Charity has pain on the left side of her jaw. She's going to take her right hand and put it right on her mandible, which is the bone of your jaw. And she's going to just apply a little bit of pressure there. She's going to keep the tube in her teeth, so she's not really squeezing down on it, but it's not falling out either. And she'll keep her jaw in a pretty neutral position, but she's going to apply some pressure into that. And so she'll hold that pressure for about 5 seconds and then relax. So apply pressure, 2, 3, 4, 5, and then relax. So that is the isometric contraction portion of the TMJ protocol. And again, she's contracting her muscles away from the painful or affected side. The last portion of the TMJ jaw protocol is a tubing distraction or pulling. So we put the tube in our mouth, we're going to bite down, and we're going to try and pull it out of our mouths, but we're going to clamp down so that that won't happen. So we have Charity applying some pressure, and she's going to be moving it in all different directions and maintaining that pressure. So it's a pretty good workout. And she's doing a great job with that. So right from the neutral position, we're just trying to build up a little bit of strength in the jaw that way and pulling in all different directions. So that is the tubing distraction.